In this video, we'll do an exam review on subarachnoid hemorrhage. Three layers covering the brain and spinal cord are: number 1, Pia Mater, outermost; arachnoid matter, the middle one and is avascular; and the Pia Mater is the innermost that wraps around the brain and the spinal cord and is highly vascular. Where is subarachnoid space? It's the space between the arachnoid matter and the Pia Mater. Pia is the innermost and arachnoid is the middle one, dura being the outer one. And where does CSF circulate? CSF circulates in the subarachnoid space, which is between arachnoid and Pia Mater. Causes of subarachnoid hemorrhage. The most common cause of subarachnoid hemorrhage is rupture of an intracranial malformation of saccular or Barry's aneurysm. It may be small, less than 3 mm, or large, more than 25 mm in diameter. So the most common cause is a rupture of a saccular Barry's aneurysm, and other causes are dural AV fistula, infective or mycotic aneurysm, Ehlers-Danlos syndrome, and adult polycystic kidney disease may also cause it, and hypertension and smoking may also lead it. So amongst the causes are rupture of a Barry's saccular aneurysm, then dural AV fistula, infective mycotic aneurysm, hypertension, and smoking. And in this condition, bleeding occurs in the subarachnoid space in which CSF also flows. Now the clinical features of the subarachnoid hemorrhage: there is sudden severe headache, nausea, vomiting, and neck rigidity; focal neurological deficits, mental and motor dysfunction, cranial nerve deficit also occur. So sudden severe headache with nausea, vomiting, and neck rigidity, and focal neurological deficits are the features of the subarachnoid hemorrhage. Why does hydrocephalus develop in subarachnoid hemorrhage? Impaired CSF resorption at the arachnoid granules results in communicating hydrocephalus. Arachnoid granules are the point where CSF is reabsorbed, but damaged blood blocks the reabsorption of the CSF, leading to communicating hydrocephalus. Depending upon the sign symptom, subarachnoid hemorrhage is graded into different stages. Grade number 1, mild headache with normal mental and motor function. Grade 2, subarachnoid hemorrhage, there is severe headache with normal mental and motor function, but there are cranial nerve deficits. So in grade 1, mild headache; grade 2, severe headache with cranial nerve deficits; in grade 3, there is somnolence, confusion, cranial nerve deficit, also mild motor deficit. Grade 4, there is moderate to severe motor deficit and intermittent reflex posturing, whereas in grade 5, there is coma and reflex posturing. So I repeat the grading: grade 1, mild headache; grade 2, severe headache with cranial nerve deficits; grade 3, somnolence, confusion, cranial nerve deficits plus mild motor deficit; grade 4, moderate to severe motor deficits and intermittent reflex posturing; and in grade 5, there is coma and reflex posturing. Now, lab investigation of subarachnoid hemorrhage. Non-contrast CT, which demonstrates hemorrhage if done in 72 hours. Lumbar puncture. Lumbar puncture is done if CT is non-diagnostic. It gives a bloody spinal tap, and there is xanthochromia. What's xanthochromia? It contains oxyhemoglobin in 6 to 12 hours after the hemorrhage, and it lasts for 1 to 4 weeks. Number 3, cerebral angiography. It localizes the ruptured or unruptured aneurysm. So cerebral angiography localizes both ruptured or unruptured aneurysms, whereas CT non-contrast that demonstrate hemorrhage, and LP is done if CT is non-diagnostic, there is bloody spinal tap and xanthochromia in 6 to 12 hours. EKG shows cardiac ischemia, ST depression, T inversion. Now the treatment: surgical and medical. Surgical treatment is the repair of the aneurysm, and medical treatment is triple H therapy, control of hypertension, hemodilation, and hypovolemia. What's the purpose of controlling hypertension? Bleeding may cause focal ischemia or stroke, leading to death. Blood pressure is controlled to preserve cerebral blood flow and to decrease the risk of rupture. So bleeding may cause ischemia, stroke, and death, and blood pressure is controlled to preserve cerebral blood flow and to decrease the risk of rupture. So what drugs are used to control the blood pressure? Calcium channel blockers, they prevent the ischemic injury, and number 2, vasopressors, they increase the cerebral perfusion by increasing arterial pressure. So two types of drug, calcium channel blockers and vasopressors, are used in subarachnoid hemorrhage to control the blood pressure and to preserve cerebral blood flow and to decrease the risk of rupture. Number 2, prevent fluid and electrolyte imbalance, especially hyponatremia, which occur due to renal sodium loss in subarachnoid hemorrhage. So decrease in sodium causes hypovolemia. And to prevent deep vein thrombosis, heparin therapy is done following craniotomy. And impaired CSF resorption at the arachnoid granules results in communicating hydrocephalus. So severe hydrocephalus requires ventricular catheter to drain the CSF. So inability to reabsorb CSF from arachnoid granulations causes communicating hydrocephalus, which is controlled by or treated by ventricular catheterization.